my name is Claire. Thank you for having me to present today. I'm a small animal vet from the UK and in my final year studying conservation medicine. For my dissertation research project, I worked in collaboration with the Olive Ridley Project to investigate entanglement of sea turtles. Entanglement is a major threat to many marine species and can occur in a variety of marine debris, most commonly in ghost nets. Modern fishing materials are often synthetic and can persist in the marine environment for long periods of time. They may become distorted and form larger openings, which increases the probability of entanglement. With ocean currents and extreme weather patterns, these nets are globally distributed. Entanglement can have severe effects to many forms of marine life, affecting their growth, preventing normal behaviours, and in turtles we see deep wounds, limb amputations, and ultimately these can lead to starvation and death. Over the course of 4 years, from 2016 to 2020, the ORP reported 651 injured marine turtles in the Maldives, of which 87% were due to entanglement, and 88% of these were olive ridley turtles. Recovered marine species will only make up a small proportion of the true number of entangled animals, as ocean currents, decomposition, and disentanglement after death will mean that many are never seen. Entanglement is therefore an issue faced by many marine species, negatively impacting individuals, populations, but also habitats and ecosystems. Buoyancy syndrome is a condition often encountered in rescued turtles. This may be when they're found or developing during rehabilitation. Buoyancy syndrome occurs when a turtle is unable to maintain its desired position in the water. Most commonly, this is positive buoyancy. There are many reported causes of buoyancy disorders, including respiratory disease, systemic infections, trauma, malnutrition, neurological disorders, and behavioural. The most commonly reported cause in the literature is respiratory disease. Buoyancy syndrome can lead to increased risk of entanglement, bycatch, vessel strikes, predation, starvation, and strandings. There is definitely a need for further research into this condition, as currently there is very little in the literature. An analysis into possible associations and health impacts could shed more light on the condition. So with this background information in mind, these are the research questions that we developed. Looking at variables that could be considered risk factors for entanglement, investigating the possible health implications of entanglement, looking into associations with buoyancy syndrome, and factors associated with a successful outcome from the rehabilitation centre. To answer these questions, we carried out retrospective data analysis on patient records from the Olive Ridley project over a 5-year period. The first step in this process was to tidy the data, ensuring a standardised endpoint and consistency in data formatting, especially for the numerical data. This was then imported into R, and independent variables were identified, allowing creation of a new CSV file with 1 row per turtle. Statistical analysis was carried out in RStudio, and initial exploration was carried out using plots and descriptive statistics for the intake sheet containing 157 turtles. More detailed statistical analysis was then carried out based on any associations found above. This used the inpatient records containing 119 turtles, looking at health impacts, buoyancy syndrome, and their time during rehabilitation. Chi-square test and logistic regression were then used to understand statistical significance of any associations identified. So this first table of results show that entanglement make up the vast majority of cases admitted to the rescue centre, and that most of these are olive ridley turtles. The most frequently presented life stages are juveniles, accounting for 47.8%, with adults 31.2%. Although it's very difficult to sex adults until they're fully grown adults, 38.9% admitted were female, but 52% were of unknown sex. Across the 5 years, it's possible to see that there is a seasonal pattern in admissions, with peak admissions occurring during the northeast monsoon season. However, this finding wasn't significant. Looking at the first question, what variables are associated with entanglement that may be risk factors? Using logistic regression, the following associations were found to be statistically significant. Green and hawksbill turtle species had significantly lower odds of presenting entangled, while females had higher odds. Yet, as mentioned earlier, 52% of turtles admitted were of unknown sex. Therefore, this finding is potentially unrepresentative. Entangled turtles had higher odds of ghost nets being present at admission. The admission variables of life stage and season of admission were not found to be significantly associated with entanglement. Based on this analysis, species and the presence of ghost nets were considered to be risk factors associated with entanglement. Looking at the second question, what are the possible health implications of entanglement? Flipper injuries present at admission had significantly higher odds of being present in entangled turtles. The diagnosis of osteomyelitis, an infection of the bone, and the development of buoyancy syndrome during rehabilitation both had significantly higher odds of being diagnosed in turtles which were entangled at admission compared to non-entangled turtles. The need for intervention with topical wound care and/or surgery were also significantly associated with entanglement, shown here with the increased odds ratio. These plots show the increased odds of entangled turtles being diagnosed with osteomyelitis and the development of buoyancy syndrome during rehabilitation, despite the small overlap in confidence intervals. Similarly, these plots show the increased odds of the requirement for amputation surgery and topical wound care associated with turtles which presented entangled at admission. Moving on to the third question, looking at associations with buoyancy syndrome. Buoyancy syndrome was split into three categories to help with analysis: turtles which were buoyant at the time of admission, those which developed buoyancy during their rehabilitation, and those which had buoyancy at any stage from admission to their final outcome. For turtles buoyant at admission, there was an association with season, as buoyant turtles had significantly lower odds of presenting during the southwest monsoon season. Turtles buoyant at admit also had significantly lower odds of presenting with flipper injuries, even when entanglement was added into the model to check for confounding. On initial investigation, buoyant turtles also appeared to have significantly lower odds of requiring surgery, but when entanglement was added into these models, this finding was no longer significant. There were 11 turtles which developed buoyancy syndrome during their rehabilitation and were not buoyant at the time of admit. Turtles missing flippers at admission had significantly higher odds of developing buoyancy syndrome. And in terms of interventions during rehabilitation, turtles having amputation surgery had significantly higher odds of developing buoyancy syndrome too. However, it is not possible to establish any cause and effect relationship here. When considering buoyancy syndrome overall, including all turtles recorded as having buoyancy syndrome at any point, significant associations were found with missing flippers at admission having a higher odds of having buoyancy syndrome, and lower odds if turtles had flipper injuries at admission. With the final question looking at successful outcomes from rehabilitation, turtles admitted due to entanglement had a positive association with longer durations in care. There was no significant associations identified between admission variables of species, life stage, sex or season and the overall outcome, which was grouped into three categories: released, deceased or current patients. However, turtles with buoyancy syndrome did have significantly lower odds of being released, whilst turtles admitted due to entanglement had significantly higher odds of being released, as shown here in these plots. Using a chi-squared test to look at change in body weight over duration in rehabilitation, we found a change in weight had a significant effect on overall outcome, as turtles gaining weight were more likely to be released. So in conclusion, some takeaway points from my dissertation were: the most commonly admitted life stages were juveniles, and species were olive ridley. Entanglement was the main reason for admission, and ghost nets were highly associated with this. And we've seen that there are several significant negative health impacts, definitely including flipper injuries. Buoyancy syndrome was associated with missing flippers and amputation surgery, and I think there's a potential for a behavioural component here. Rehabilitation outcomes were positive, with just over 60% released, and rescue centres definitely represent a wealth of information and data that could be collated and analysed further to help improve conservation outcomes. Thank you for listening today, and I welcome any questions that can be sent to my email address. Thank you.